Good morning, Maryland. We are live on the WMAR2 News Facebook page with two of our friends from GBMC. Thanks so much for joining us. We are joined this morning by Jennifer Seiler and Kaylee Kohler, both certified child life specialists at GBMC. Ladies, thanks so much for joining us this morning.
Thank you for having us.
Okay, Kaylee, let's start with you. First of all, for the folks out there that don't know, what exactly is a certified child life specialist?
Yeah, great question. So a certified child life specialist is somebody who is in the healthcare profession. We work collaboratively with the medical team, and our goals are to help normalize the hospital experience for children and families. We are part of the medical team, so we really work together with the nurses and the doctors and everybody involved in the care to help advocate for children and develop and prepare coping plans and support children throughout their hospital experience and their families as well.
Yeah, and Jennifer, let me back it up a bit because I can imagine if there's a family with a child who has to be in the hospital. I mean, just from the start of it, you're dealing with something that is certainly unfamiliar, potentially frightening for the family, but also for the child. What's that like dealing with those kids on a daily basis?
Yeah, so that's one of our main roles is to help ensure that patients and families understand their reasonings for being in the hospital and knowing that the hospital environment most likely is unfamiliar. We want to help bring familiarity to them by helping them make sure they know and they feel prepared for what's going to happen during their hospital experience. So patients know what's going to happen to their body, what tests and procedures are going to happen. And then we're also inform the parents to make sure they understand what's happening to their child. A main role of a parent is to support their child, so they need to understand what's happening. And we're also going to give them a role in supporting their child in the hospital as well.
And Kaylee, I imagine, there's varying levels of what the kids are in the hospital for. But, at times I'm wondering if the kids show a lot of bravery and being in there and facing whatever's going on.
Yeah, I think that's one of the most magical parts of the job is really watching children come in scared and unsure of what's happening, and throughout their time and working with them, helping to empower them to know that they can do hard things, and being brave and being scared are things that can go together. And so, even if, you'll hear child life specialists say all the time, it's okay to cry, you can scream, you can do whatever you need to, just stay really still. So it's really helping to secure them and let them know that they're capable of hard things. And one of the greatest things about being a child life specialist is after they accomplish that and seeing their faces and seeing how happy they are and how proud they are, really just makes it all worthwhile, knowing that you help them believe that they can do it, and really highlighting to them that they're the center focus and they got this. So that's one of the greatest parts of the job.
Yeah, Jennifer, how do you handle that too? Because I mean, sometimes if they're in the hospital, they might be, getting even like a little prick for a test of some kind. They might even be getting blood drawn. They might be having things that kids don't always like having happen to them. So how do you handle that and keep those kids in good spirits?
Yeah, I know when I'm working with patients and families, I always say that there's no surprises in a hospital. And so we are always going to let you know before something happens to your body. So one way that we do that, we might, if they need to get a needle, a blood draw, or an IV, we might take them through the steps of the actual procedure using real medical equipment. I have a little friend with me where we might use a stuffed animal and we'll use the tourniquet, we'll use the alcohol wipe, we'll go through all the steps, we'll develop a coping plan, and maybe they want to watch, maybe they want to sit on a parent's lap, maybe they want to cry, and that's okay, but their only job is to stay still. And if they need, a lot of times it's hard to stay still when we're nervous. So sometimes we bring in helpers to remind our body to stay still. So we're really trying to educate and empower these patients to cope however they need to, but knowing they're not being punished. They've done nothing wrong. The hospital is a safe place for them to be. And this is why we have hospitals, to figure out why their body isn't feeling a certain way or why their body's hurt and how we can make them feel better.
Kaylee, I'm going to make an assumption, and I apologize if I'm going way off base, but what Jennifer is describing is it sounds like it's probably a lot different than it was maybe a few years or maybe a few decades ago, when, my general idea might be that the kids in the hospital, the doctors are just going to do what they do and not really consider the kids' feelings as much. It sounds like we're being a little more empathetic these days.
Yeah, I think one of the things that we as a society are learning is that no matter how small you are, your voice is still really important. And so we're really here to just help highlight that and help advocate that. We've seen such an amazing support from the medical team too, where we have doctors that will come to us and say, hey, I got to do this. And I know this kid is scared. Do you mind going into the room first to talk with them? So that way, then they know what's coming. It's really cool to watch a medical team where in a world that's always hustle and bustle and get in, get out, watching a team slow down to help make sure that they're supporting the whole picture of a patient, not just the injury or not just the illness, but who is that kid? You know, there's something before they are their illness. And so to watch that, to see in a NICU setting, the tiniest of babies and nurses still making sure there's a cute blanket underneath them instead of the hospital blanket or a bow on their head. And even as the older kids, making sure they have things like a Nintendo Switch or just different things to help normalize that. Watching the medical team really help support that and focus on that, especially as we've gone through a pandemic where we had to pause with how many people could be at the bedside. Everybody sees how important it is to have the entire support system around that child and how much that helps them cope. It makes everybody's job easier because they have their support network with them.
Yeah, and I'm going to ask you both this one. Kaylee, I'll start with you because you kind of brought it up. The past 2 years, everybody's been talking about the various changes in schools with wearing masks or even going to school remotely a little while back. How has COVID impacted all this, and what's it been like for the past 2 years for you and the kids at the hospital?
Yeah, COVID it's been a doozy, hasn't it? It's just been so hard because one of the biggest things is that having to wear masks, you automatically take away half of your face. And so kids are already so unsure of who you are coming into a room. They've never seen you before. They've never met these people. And during a pandemic, we had masks on, we had eye shields, we had gowns, gloves. I mean, you were seeing little minions almost. You weren't seeing a person. And so just by having to have so much more isolation, there's less movement where there's not as much interaction between patients of, normalizing play. I think one of the biggest things too, and being in a NICU setting, is that there were limits of how many people could be at the bedside. So you're having parents deliver a baby and it's the most exciting time of their life and they can't even meet their child together at the same time because there's only one person at the bedside. And that's a really hard thing to help support families when we're taking away the people that they trust the most, and that's each other. So I think the pandemic, it had such a large impact, but one of the things from a child life standpoint was really seeing the impact it has on who could be at the bedside and who could change in and out, and who could be present, with those kids.
Jennifer, it sounds like there must have been a lot of changes. I imagine back at the beginning of all this, now literally 2 years ago, there must have been a lot of discussions at the hospital about, look, how are we going to do this? What was that like? And are you starting to be able to at least make some changes back towards something resembling normalcy?
Yeah, so as you're talking about the changes that when, COVID first hit, one of the things, and Kaylee talked about this, is the medical team that patients and families recognized now look different. So one of the first things that Child Life and the hospital started to recognize is how different we look. So how can we help support patients and families to know that we are still that medical team that provides that support and medical care? So one of the things that we did face stickers for our badges. So I don't have one on me, but we would have our picture on our badge. So one of the first things we would do when we walked into a room was, hi, my name's Jenny. I'm a child life specialist, but this is who I am underneath this mask, underneath this eye shield. So we can start that emotional connection, because without that, we can't really support patients and families. We need to have some sort of connection. So that was one thing that we definitely adjusted to very quickly. We also allowed FaceTime. We also allowed phone calls. So we really tried to work if families could not be at the bedside, to ensure that families could understand what was happening to their child.
Another change that's kind of been happening over the years is somewhat of a push to maybe not have people stay in the hospital quite as long. I don't know if that's the same with kids or if it's kind of not in your experience, but are you still able to make the time that they're there effective and kind of help them through that, even if it's not going to be as long of a stay as it may have been even 5 or 10 years ago?
Yeah, I think through the pandemic, we have seen such a high and lows of patient volumes coming in. And being in a pandemic, the hospital was not a safe place. It was a scary place because that's where COVID was. That's where the germs were. So though we can't, dictate how long a patient stays, what we can do is make the hospital a comfortable place and a safe place to be. And so that was one of our biggest roles in Child Life, for us to have those face shield stickers, for them to understand everyone's role on the medical team and how we're going to help them, what visitation was going to look like. We would have pictures of their inpatient rooms so they know if they had to spend the night, this is where they're going. This is where mom and dad can spend the night. This is your bed. Or if you have to go to another hospital, we also did that same process with ensuring that they really felt comfortable and knew that a hospital was a safe place and that there were people to take care of them and their family.
Kelly, it sounds like it has to be a prerequisite that you care about kids and are good with kids in order to do this. How did you wind up getting into this field? And has it been a positive? Would you encourage more people to look into it?
Yeah, so I knew when I was younger that I wanted to work with kids. I loved the idea of being in a hospital setting, but I wasn't quite sure being in the medical side of things. Math and science were not my strong suit. So I knew that medical side was going to be really challenging for me. And so through just a kind of an exploration, I discovered Child Life as a profession. Was really fortunate that I grew up in Maryland and Towson has a program for it. And so my mom's always right. She'll love to hear that, but she's the one who really kind of pushed me to pursue it. I was a little bit hesitant because I didn't know as much about it. And so through getting a bachelor's and then I went on to get a master's in it, one of the cool things with Child Life is they really make sure you get the fieldwork experience before you dive into this career. So they encourage volunteer work and, hands-on experience. You have to do a 600-hour internship prior to starting the career. And then once you do, you have to pass a certification exam. And then by the time you're getting into it, you're years committed into this. And so it's something that is a hard job. It's a lot of education, explaining what we do, why we do it, the intention behind our decisions. But it's a job that I love. And it's a job that even as healthcare has been really hard to be a part of because the pandemic hit us in all ways that, none of us could even see 2 years ago. Watching people rally together, watching people support each other, having GBMC that highlights, everybody here matters. And so what are we going to do to help support you guys through that? Watching the field grow even amongst a pandemic. Jenny can speak of that more, but there was roles added into it. So, the pandemic didn't stop our tiny team from growing. And it's something that I 100% love doing and would encourage others to look into it and, follow along their dreams.
Well, that is interesting, Jennifer, because it's, obviously even with COVID, it seems like the need would have even increased potentially. But the restriction of having more people around also came in place. So how is that being handled now? And is it something that you expect to see potentially even more certified child life specialists coming around?
Yeah, I mean, that's the hope. I'll say when we first started our program's only been established for 5.5 years. So when we started at GBMC, we have a combined care unit. So we have one side of the unit is an ER, the other side is the inpatient unit. So that's where we started. We only provided 5 days a week coverage from 12 to 10 p.m. So through those 5 years, we were able to ensure 7-day coverage with actually 12-hour 11 a to 11 p.m. coverage. But when COVID hit, like many hospitals, our patient volumes dipped a little bit. So we had to reevaluate where our team could be providing services because there was still patients within GBMC, they were still pediatric. So one of the things that really emerged from COVID is having a child life specialist dedicated in the neonatal intensive care unit where Kaylee is currently. And we're providing that support for families because the pandemic didn't stop babies from coming. It didn't stop parents from having worries, typical new parent worries, and then put a pandemic on top of that. So we really needed to provide that psychosocial support outside of our combined care unit. So that was one of the things that our program grew. We would love, we are here for pediatrics as a whole at GBMC. When the vaccine was approved, we actually supported a pediatrician's office here to help support when kids 5 to 11, and that age is really, they get nervous about getting needles and needing vaccines. So we anticipated that. We reached out and we actually supported during a vaccine clinic. We had them meet with one of us prior to getting their vaccine. We went through the steps of a vaccine. We developed a coping plan, which allowed them to either sit alone or sit with a parent or maybe count before the needle goes in. And then I actually have a bravery certificate. I know we were talking about it, but they also then at the end got a bravery certificate. So those are things that our team has definitely adjusted and adapted through the pandemic. And we do have more pediatrics here at GBMC, so we would love for our program to grow. We are a grant-funded program, so we're always looking for donors and always looking for more money to fund our Child Life program here at GBMC because we are here for every pediatric who comes through the door.
Jennifer, before I ask Kaylee about this, I want to ask you too. Do you see, whatever the child is in the hospital for, potentially the doctor's treatment or whatever it is, surgery or who knows what. Would you say, though, that having the certified child life specialist there down the road winds up with potentially getting to a better outcome for the kid, even outside of their, the physical treatment of whatever they're actually there for?
Yeah, there are studies that shows that, I'll give surgery as an example because we actually haven't talked about surgery, and that's another area that we do have a child life specialist dedicated to, and that's that pre-surgical area. So they're preparing patients and families for coming in for surgeries prior to the day of and also day of. But there's tons of studies and research that prove that support that we provide on the front end actually can decrease the length of a patient's stay, help save hospitals money, and to allow for more patients to come into the hospital. So there is lots of research and evidence-based practice that we are doing to help improve, how a patient hospital can run, because we can help to decrease the length of stay. We can, in the ER setting, there's multiple times that we are able to through procedure or through preparing them for an experience, they might not need medication to calm them down. They might not need sedation. Therefore, we're saving the hospital money on medication. We're also decreasing the amount of staff that needs to be in the room who then can be productive to support other patients and families. So we're here, again, as a multidisciplinary team member to help support everyone, families and the staff and the hospital as a whole to meet their needs.
And Kaylee, if you're in the NICU, you're not dealing with patients that are quite old enough to be responding to directly with and telling you how much they appreciate what you're doing. But do you still see it, and do you still feel that the outcome is going to be better for the very youngest patients whenever they're ready to leave the hospital?
Yes, I love that you asked that question because I get often, NICU, what do you do there? And I think what we all forget is no matter how small that baby is, they still have feelings. Prematurity, babies feel pain more than they actually feel positive touch. And so as a child life specialist, I can help teach parents who are terrified because their baby is, 1 pound, 2 pounds, how to touch their baby in a way that's therapeutic, not only for the baby, but for themselves. And how they can help calm the baby so that way then their heart rate goes down. And we can help. The NICU is phenomenal at encouraging kangaroo care, where you hold the baby skin to skin on your chest. And that's proven to show that the baby's respiratory rate, heart rate goes down, and they actually need less, oxygen support. And so it's also supporting not just the baby. We're, trying to encourage a reading program now where parents can feel empowered to read to their baby, which shows down the road that the more babies read to, the more that their language development, it shows increase in literacy rates. And so there's different things that we can really help support parents, whether it's their first time child, first baby, or maybe this is their seventh baby, but it's their first time in a NICU setting. Being in a NICU is terrifying. And it's, you have a very tiny baby, and sometimes there's just such a little amount of baby and so much more equipment. So it's helping to encourage families to ask those questions and not feel like what they're asking is a dumb question. I often say you're co-parenting with an ICU. It's not easy, but you are still in the driving force of this, and you are still, the baby's in charge and you're in the passenger seat and we're behind you. And so we're encouraging that. There's also siblings. And what we've talked about with this pandemic is that we can no longer have younger children at the bedside. So we have some children that celebrate 150 days of life and have never met their brother or sister. And that's a really big deal, as mom and dad are kind of coming back and forth and trying to support each kid who needs something totally different. And so there's ways that we're finding, how do we promote bonding where you can actually touch your sibling and help them cope with that too. So that way then down the road, they feel well supported through that as well. So there's the sibling support, the parent support, the baby support, and the staff support, and really helping them to know that what they're doing is helpful and matters, and how we can help support them through that, whether it's procedures or snuggling a baby. That's one of my favorite parts of the job, is holding that baby. So they may not say thank you with their words, but with their actions, they definitely do.
And you can feel that. Well, it certainly sounds like big help for the kids and also for the rest of their families. So thanks very much for what you do. Before we let you go, let me ask Jennifer. You mentioned it was grant funded. Are there ways that people externally can support the Child Life program at GBMC?
Yeah, so we do have a website. I'm not sure if the link is anywhere. I'm sure we can comment it later. But GBMC, oh, wonderful.
There it is.
Yeah, so if you go to our website, there's more information about the Child Life program at GBMC, the areas in which that we do provide coverage with the dedicated Child Life specialist. And then there's also ways to give back. So we are always in need of toys and resources. We're always going through stress balls and Play-Doh. These are things we can't clean. So we're always open to getting donations of those, or art supplies or books. And then there's also a way for monetary donations. So we're grant funded. We're always looking for people to support our program to ensure that we stay within a community hospital, which is pretty unique in this area. We are one of two programs in Maryland that has a Child Life program established in a community hospital. And then we also have volunteer opportunities, which again, all information is on the website, that if you want to volunteer some of your time to help clean our toys, to help organize our resources, and also spend time with some of our patients, playing games, having conversations, all that information is on our website and ways to give back. And we also love feedback. There's an opportunity for patients and families to provide any kind of feedback after working with a specialist. And we get that feedback, and always continuing to improve our program, and also continuing what we're doing right. So we always love feedback as well.
Okay, let's see if we can get a couple pallets loaded with Play-Doh over to GBMC.
That would be great.
Child Life program. Jennifer Seiler and Kaylee Kohler, thanks so much for joining us this morning from the Child Life program at GBMC. And thanks to you for watching this special Facebook Live discussion. Have a great day.
Thank you.